Hello, everyone. We will get started with today's webinar. Thank you for joining. My name is Tiffany Netters, and I serve as the Director of Health Policy and Governmental Affairs for LPCA, the Louisiana Primary Care Association. We are grateful today to have our partners with the Louisiana Hospital Association Trust Funds to provide this webinar for us within the community health centers. This is our second session within the Risk and Patient Safety webinar series that we have partnered with the LHA Trust Funds for. Now I'd like to turn it over to our presenter, Stacy Jenkins, who will present to us on a focus on patient safety in the healthcare clinic. Stacy, I'll turn it over to you.
Thank you, and good morning. And thank you for having me here today. I appreciate the opportunity to speak to you guys. My name is Stacy Jenkins, and I'm a registered nurse, and I've been a registered nurse now for about 25 years. I have a master's degree in nursing informatics, and I have worked in the area of quality, patient safety, risk management now for probably 16 to 18 years. And within the last 8 years, working with healthcare clinics and hospitals throughout the state of Louisiana with the LHA Trust Funds. So today, I'm going to talk to you for a little bit about a focus on patient safety, specifically in the healthcare clinics. And some of the objectives I have for the presentation today are that we're going to discuss some of the top risk management concerns in the healthcare clinic setting, and we're going to talk about some mitigation strategies for those top risk management concerns, and we're going to talk about how you can select an appropriate strategy to identify the risks in the clinic. So the reason why we really want to talk about and why it's important to talk about patient safety in healthcare in general is because it's the third leading cause of death is medical errors. And, you know, that's really kind of sad when you think about that, because a lot of medical errors are, you know, they're human errors, and some of these things can be prevented. About 251 deaths per year are caused by medical errors. So that equates to about 21,000 deaths every single month from medical errors. And that's a lot. The importance of talking about patient safety in the ambulatory care setting, in the healthcare setting, is really because of the high volume of patients that you see on a daily basis. And one study that I read actually reported that in 2013, there were approximately 922 million clinic visits, as opposed to 33 million inpatient admissions into the community hospitals. So that's pretty significant difference. It's actually kind of a mind-boggling number of visits. So anywhere you have a really high volume, you have more opportunities for failures to occur in that setting, and that's what makes it so important. Another study that I looked at went from 2005 to 2009, where there were about 11,000 medical malpractice claims that were paid out on behalf of physicians, and about 43% of those were related to care in the outpatient setting. So even though you may not really think that clinical errors in the healthcare clinics could really be that harmful, they can be. And sometimes it may not be just one single event that occurs, but it's a culmination of a lot of little things that just stack up to create one big problem for a patient or their outcomes. So healthcare over the years has really kind of shifted, and I think that's another reason why we really have to look at patient safety in our healthcare clinics, is because we've really gone to consolidating our hospitals with our clinics with our hospitals, and we're moving to a systems-based care. A lot of healthcare now is, you know, we're being pushed from the days when patients got easily admitted to, we're really pushing that care into the community settings, into the healthcare clinics, and we've moved away from a lot of the solo physician office practices that exist out there. So you're just seeing more healthcare in the community, in the ambulatory care setting. So it's important that we focus on our processes and how we ensure the safety of our patients. The healthcare clinic, I mean, you're very unique. Your patient safety concerns, although similar to other patient safety concerns, say on the hospital side, they're unique. You're a unique bird, and you have unique challenges and barriers in your setting, and that is what we want to really focus on today. So the first concern I want to talk for a few minutes about is the accuracy of diagnosis and follow-up. Misdiagnosis and delay in diagnosis are two of the most common medical malpractice or professional liability claims that we see in the trust fund for sure. And I would say they're even nationwide some of the most common. About 25% of all medical malpractice claims fall into these two categories. So let me give you a couple of examples about what types of things that we see related to this. So an elderly patient was sent from his PCP's clinic to the hospital for a chest x-ray. The results showed a suspicious area in the lung base. The physician never received the results and did not follow up on the test he ordered, and the patient was seen 11 months later in the hospital emergency room where the chest x-ray was discovered by the emergency room physician. The patient expired 5 months later, and the clinic and the physicians were sued. So that's just one example of how, failure to follow up on testing led to a delay in diagnosis, which which very well may have, had we caught this, this mass early, maybe could have extended the life of this individual. So that's one example. Another good example is a 60-year-old patient who presented to a rural health clinic and had annual lab tests done. One of those tests was a PSA screening, which was elevated. The PCP never saw the results or followed up on the results. And 5 months later, the patient returned to the clinic, and the PSA result was discovered at that time. And he was sent to a urologist and was diagnosed with a high-grade adenocarcinoma. And both the clinic and the physicians were sued. So that's another good example why follow-up is so important, because if lack of follow-up is a very common cause that leads to these two diagnoses. So I encourage you to look at your test tracking. All tests that are ordered in the healthcare clinic should be tracked for return results. You need some type of a log, whether it be manual or electronic, that you can track the tests that are ordered, that they are reviewed to ensure they're reviewed in a timely manner by the physician. The results need to be relayed to the patient, whether they are normal or abnormal. Used to, we only called test results that were abnormal. That's not the case anymore. The best practice is to inform the patient of normal or abnormal results. And all this needs to be documented and filed in the appropriate medical record. So you need to be able to show documentation of each piece of this tracking system. Don Berwick, CEO and president of the IHI, made a statement that every system is perfectly designed to get the results it produces. And what that really means is if you have a test tracking system that has holes in it or is extremely arduous and isn't reliable, then it's going to give you the results that it was designed to give. That there's going to be results, that result in failures or miscommunications. So you need to look at your test tracking process from beginning to end, write it out step by step with your team, and focus on redesign of that process. It may not be that it's just little revisions. You need to think of it on a total redesign of how you do things. Some good points for redesign are that you need to standardize your process. Everyone should be doing the same thing every time. So the staff who work on Monday and Tuesday should do the test tracking process the same way that we do it on Wednesday and Thursday. Everybody does the same thing. It needs to be a simple process. So if you're looking at, steps to this process, that just go on and have to go through multiple hands before it gets to the physician or finally makes it into the files, that might not be a really good process, because a lot of times the more steps in the process, the more opportunity you have to make a mistake. So you want to simplify that process. And implement hard stops anywhere you can. Now, the hard stops are really meant for when you have like electronic systems where you can have, where you can actually force a command, or for somebody to do something. It won't let you go to the next step before you complete this step. But if you have an electronic process in place, hard stops are something you should really consider. I would challenge you to tackle technology. The manual process, I guess if you've been doing that way forever, it's probably good, but if you have the opportunity to look into some electronic processes for test tracking, there's some really effective tracking systems out there that will, send alerts, and some of those will even, when the test results are entered into the computer system, will send the results directly to the intended party, like to the physician, and they kind of go in a queue where they have to be acknowledged before you can go on and things like that. So those are some really good technology pieces out there to help support the human processes. The next concern I want to talk about is documentation. And really, these patient safety concerns that I'm talking about, they are in no particular order. I don't really think that one necessarily trumps another one. They are really kind of all on the same playing field. Documentation is so important, and really the old adage still applies: if you didn't document it, you didn't do it. I know, for one, I learned that in nursing school, and I have come across this same thing over and over again. And your documentation in the medical record, when you have a professional liability claim, it really is going to be your best defense. I know myself and the other consultants that I work with, we do education with office practices and with hospitals all the time, talking about medical record documentation. And I always tell the nursing staff when I talk to them, just think about that your medical record, when it goes before a medical review panel, it has to be able to stand on its own 2 feet. You don't get to go with it, and you don't get to say, well, I meant to write, and that's not exactly how that exactly went. You don't get to make those excuses. So it needs to be in the record the way you meant it to be the first time. The medical record is very important. It shows things like the plan of care that's outlined. So how the physician is planning the patient's care for the condition, things that are ruled out, reasoning and rationalization for medications and treatments that are planned. So, it really shows like the thought process that's gone into the planning the care of the patient. It should have objective information in it, factual. It shows the continuum of care, referrals, consults, any kind of follow-up that you do on testing or consults, and any communications that you have, whether it be with other physicians, whether it be with the hospital, the lab, radiology, or even with the patients and their families. Documentation should be in that medical record. Patient engagement is something else that's really important, and I think your medical record can show that when you document those notifications of normal and abnormal results. As I said before, the norm used to be, well, we'll call you if, there's anything wrong with your test. Well, that's not exactly the best practice anymore. Everything now is moving toward engagement of your patients and sort of giving the patient some accountability and responsibility in their own health care. And it's okay to tell the patient, your test results are going to be back on Wednesday, and I'll call you and let you know what the results are. But if you haven't heard from me by Thursday, give us a call. Now, that doesn't necessarily relieve you of the responsibility of reporting the results, but it kind of helps give the patient some responsibility in the process as well, maybe to help remind you of that, to kind of help us stay all on track. You can document in the record and show the involvement of the patient, involve the patient to follow up. And also another thing with that you can do is to consider phone systems. Some kind of phone system that where you can record results and the patient can actually call in with a PIN number. And I think patient portals have kind of helped with this patient engagement as well. It's important in your organization to create a culture of change, a culture of safety for error-prone processes. So when staff are working with, say, test tracking or documentation, your documentation, whenever they see a problem or a process that they feel like is eventually going to result in an error, that you encourage them to communicate that information to you so that it can be maybe nipped in the bud before it actually causes harm to a patient. Number 3 patient safety concern we're going to talk about this morning is communication, or shall I say the lack thereof. Communication is one of the most common root causes in adverse events that there is. Actually, the Joint Commission's database of Sentinel events has 61% of those events has a root cause of communication or miscommunication. So that's over half of the events in the database with communication issues. It's a leading cause of medical malpractice claims and lawsuits. 55% of risk managers, now this is an AIG study where they actually polled risk managers, and 55% of the risk managers reported poor communications and teamwork as one of the greatest patient safety barriers that they encountered. And 75% of the risk managers identify communication as their top challenge in patient safety. One study that I wanted to just kind of brings it together as well related to communication is a study by CRICO, and this is a large organization that does malpractice claims for the Harvard system. And they have a big database where they collect a lot of information. And between 2006 and 2010, they looked at their malpractice claims, and 42% of those were related to communication issues. This same study said that 69% of those claims were related to gaps in information, such as documentation not in the record, or to issues with the transition of care, because there's a lot of opportunity for gaps when you're transitioning from, say, one physician to the next, or transitioning a patient into the hospital. 40% of those breakdowns were between two people, like provider to provider or provider to patient. Poor handoff communications. Like I said, when you're handing off care to another provider, physician to physician, maybe the doctor's going out of town for the next week on vacation and passes off care of the patients to somebody else. And then nurse to patient, physician to patient. And that's where really comes in our communication with patients about their care, conditions, medications, and follow-up and things like that. So some of the things that I wanted to point out related to healthcare professional communications to patients. One thing you need to make sure you do is listen closely, because just by sitting and listening to your patient talk can really give you a lot of information. You can listen to your patients talk about the way they feel, how they take their medicines, and it will lead you to cues that maybe they're doing something wrong, or maybe they're taking their meds wrong. Another good practice with your patients is to utilize a teach-back methodology. And teach-back has kind of gotten popular over the last several years, where you use open-ended questions whenever you teach your patients. So if you're teaching the patient maybe some diabetic education or heart failure education, that you give them the instructions, tell them how to take their medications, and then you say, okay, now you tell me how I just told you to take your medications, or you tell me what I just told you about your discharge instructions, and just let the patient go through what they actually heard. You would be surprised how many miscommunications that occur this way. Like they don't totally understand what you're telling them. So it's real important to let them tell you what they heard and let you pick out the pieces of that they misunderstood. Nonverbal cues are very important to notice with patients. Sometimes their nonverbal cues are more important than the things they say. It gives you a lot of insight into how the patient feels or the patient's emotional state. Ask open-ended questions when you do speak to the patients. Don't just ask them something like, well, you take this twice a day, right? And let them say yes or no. You should say, how often do you take this medication? And let the patient fill in the blank. The National Patient Safety Foundation has a initiative going on called Ask Me 3. And if you go to the National Patient Safety Foundation's website, they have a lot of materials related to Ask Me 3 that might be good to use in your healthcare clinic. Maybe a poster, maybe some patient education materials where you can encourage your patients to ask questions of you and of the physicians. And the Ask Me 3 basically points them to these 3 questions. What is my main problem? What do I need to do? And why is it important for me to do this? So this really goes a lot with kind of their condition. They could use these 3 questions whenever asking about the medications they're taking. Why am I taking this medication? Why do I need to take this medication? And why is it important that I take this medication? So the Ask Me 3 campaign is really good to encourage patients to utilize. Medication management. So we take care of a lot of patients in the clinics, and they take multiple medications. A lot of polypharmacy out there. Patients see their PCP, and then they see numerous specialists. And sometimes it's difficult to keep up with what medications they're taking and the frequency. And even some patients even have difficulty understanding why they take what they take. So medication management is definitely an area of concern for patient safety. I'll give you just a quick example of a medication management claim where an office nurse at a clinic called a community pharmacy with an order which included an increased dose of the patient's routine medication, of one of the patient's routine medications. Due to the nurse's unfamiliarity with the medication and confusion over the physician's handwriting, she misread the physician's order and called in a dosage of antidepressant at 3 times the intended dose. The patient took the elevated dose and fell, fracturing her ankle and her knee. The clinic and the physicians were sued. So this one not only has to do with medication management, but through the example that I read you, if you can understand, if you heard all of the miscommunications from the unfamiliarity to the misreading of the physician's handwriting, there were a lot of small things that happened with this claim that kind of added up to one big problem for the patient. Some things to be alert with in medication management would be drug allergies, number 1. So no matter what kind of system that you use for medical records, whether it's electronic or whether it's manual, some kind of paper record, be careful to document the drug allergies in a conspicuous place on the record so that everybody can see it. The comprehensive medication lists are also very important. I think a lot of patients have kind of gotten into the habit of carrying their meds around on a little card or something in their purse or in their wallet. That's a wonderful practice. Those medications should be verified at every time the patient visits you. And it's important to do that because, as I said previously, they see the primary doctor, plus they see lots of different specialists. And it's important to go over the medication list with the patient at every visit because you don't know what happened or where they've been in the meantime before they came to you this visit. And then send the patient home with a current comprehensive list of the medication list before they leave that day. So patient education is also important related to medication management. There are a lot of hospital admissions related to patients misunderstanding how to take their medications. So it's very important to do good patient education and utilize that patient teach-back method to allow the patients to tell you how they understood what you said. On the healthcare professional side of medication management, a few things that I want to talk about are prescription security. Prescription security, we really seem to have a lot of variable ways at which we do prescriptions these days. I still see handwritten prescriptions. I see prescriptions printed out on the computer and then signed, as well as, some physicians are actually ordering medications in the computer systems and they go directly to a pharmacy. So there's quite a few different ways we're doing prescriptions right now. It's real important that if you're using prescription pads, those prescription pads need to be secure. You need to keep them locked away in a cabinet where unauthorized patients or staff cannot get to them. And never pre-sign the prescription pads. Those prescription pads can be stolen and used and sold. Actually, we have actually seen that within the trust fund where prescription pads have been stolen and sold and used for bad purposes. So make sure those are secured. As well as if you're using electronic means to, say, print out the prescriptions, or if you're even sending in prescriptions electronically to pharmacies, your password is your signature, basically. So you need to protect your password. So sharing of passwords should not happen. Whenever people are hired, they need to sign some kind of paperwork where they acknowledge that they're going to keep their password secret. That's really important. The process for renewal of medications, you need to have a policy on that and something that kind of designates who is responsible for that in your organization and how that process is done. The sample medications, we still have, I think, a fair amount of healthcare clinics that give out sample medications. Most of you may already know, but if you have sample medications in your clinic, you need to keep a log of those sample medications and their lot numbers. And when they're given to patients, you need to write down who you gave those sample medications to, the dose, and the lot number that you gave to the patient. Because in the event that the medication is recalled, we need to have some type of tracking system where we can go back and identify who got those drugs. Sample medications need to be kept out of the reach of unauthorized personnel. So they need to be in a locked cabinet, away from unauthorized people and from the public. The same goes for any kind of medications that you store for administration in the clinic. Now, not a lot of clinics actually give medications, to patients when they're in the clinic. But I would say it's pretty common to see things like vaccinations in your clinic. Those medications need to be secured. They need to be locked. If they're in a refrigerator, it needs to be locked. And only authorized personnel need to have access to that. And if you administer medications in the clinic, then you make sure that we document what we gave in the medical record appropriately. I want to talk about violence as another patient safety concern, mostly because violence seems to be on the rise in healthcare over the last several years. I think it's important to understand that in healthcare, when we see patients, often we see patients in some of their worst times. When they don't feel good, they've just had a diagnosis, maybe a really negative diagnosis, maybe something that's life-threatening, they hurt. There are all these different stressors in the patient's life when they come to see us. So you kind of see the patients and the families when they're at the worst of their worst. So that's one thing we need to realize. But there are a lot of bad things that are happening in healthcare related to violence, and you just need to realize one recent, well, I'm not sure what year it happened, but it's been probably within the last 5 years. I know there was a physician in the Northeast that gave an elderly lady a diagnosis of cancer. Well, evidently the son didn't like that, so he came back and shot the physician in the clinic. Didn't harm anybody else, but he did kill the physician. So that's just one really extreme example of things that can happen, but just to make you aware that it does happen. Probably more than anything, what you will encounter in your clinic is just frustration of patients. And I think it's important to remember to really, if you notice a patient that's kind of escalating and getting very frustrated, maybe they've had to wait for a long time in the waiting room, or something is just kind of irritating them, you might consider moving them to a quiet location. Sometimes just reducing the stimulation that's coming at these people who are getting very frustrated, sometimes that can help. So just move them to a quiet location. Patients that are complaining and are very upset and escalating in their frustration, just sometimes it helps to just listen. Just listen to these people and listen to understand, because often when we listen to people, if it's maybe just a frustrated patient, maybe he's frustrated because we didn't call him with results, maybe they're just frustrated because they had to wait too long in the waiting room, whatever the case may be, just let them vent for a little while, because frequently we listen because we think we need to reply. Sometimes it helps to just let them ventilate, let them vent all their frustrations, and it's helpful to just know that you understand and that you're there and they've been able to tell somebody. When you have somebody who is verbally aggressive, it's very important that you leave them what I call their hula hoop space. So everybody knows what a hula hoop is. We probably all did this as kids. But you know how big around that hula hoop is. So just imagine that. And it's really a good description of what you probably know as your personal space. So if somebody is being verbally aggressive with you, if you get inside their hula hoop space, inside that personal space, it's only going to make them more uncomfortable. So always make sure that you recognize that personal space boundary with anyone and stay just outside of it to avoid escalating their frustrations and their nervousness. Control yourself, because oftentimes when someone is verbally aggressive or loud with us, just a human response to just mirror that same behavior. Unfortunately, that's not the best thing to do. The best thing to do is try to maintain your composure on an even level, and hopefully their raised voice will come down to your level. Maintain eye contact, but not constant eye contact, just because that's kind of intimidating. So these are just some little tidbits to help you understand how to deal with those patients who are frustrated and maybe are complaining and raising their voice with your staff in your office. All of these techniques, it's real important that you do staff training, because a lot of the way that you communicate with people who are aggressive, verbally aggressive, and even physically aggressive, the way you deal with that is not something that you just learned in school. It's typically a behavior that we have to train our staff to deal with. Otherwise, all their human responses are going to kick in, and they're just going to deal with it the way anyone else would. And we want them to respond in a safe and effective manner to help decrease and de-escalate the situation versus escalating it out of control. So I would encourage you to find a good violence and de-escalation program. If you're in the trust fund, we typically do MOAB training, which is called Management of Aggressive Behaviors. whereby we train new instructors and they're able to go out and train their staff in just these very basic human nature type of identification and de-escalation of violence techniques. And the last one on my list, but certainly not least, is number 6, and it's the termination of the physician-patient relationship. This is probably one of the most common questions that I get asked about from healthcare clinics, and it is regarding termination of that relationship. And sometimes that happens, or it happens really for a lot of different reasons. Sometimes physicians become frustrated with patients because they're non-compliant and they won't do the follow-up care that they've been prescribed to do. And sometimes because the physician's moving away, or maybe the physician is retiring. So it happens for a lot of reasons, but the claim that can come associated with the termination of the physician and patient relationship is the claims of abandonment. So you have to just be real careful if you terminate a relationship, that it can be done. You just need to make sure you do it in the right way, and that you don't just leave the patient hanging with no care. So the AMA actually has some guidelines on this, and they are pretty readily available out on the AMA website if you go out there. But it requires things like giving notice in writing, and when you give notice in writing, that you give the patient a reasonable time frame for finding another provider, contact their insurance carrier or have them contact their insurance carrier to find out other providers in their area, offer to transfer the medical records to the new provider of care. And sometimes it's even a good idea that medical record release form, when you send the letter, just send a copy of that medical record release form. Kind of makes it a little easier on the patient and just kind of helps facilitate the process along. And make sure you keep copies of all of this, of the letter and everything for your files. I would also recommend that notice in writing go out by certified mail so you can keep a tracking of the letter, and when the return receipt comes in, just put that in the record as well. So you'll have all your documentation in the record that you did it according to the guidelines. So we talked about a whole lot of things today, and some about the patient safety concerns. So how do you know in your office practice if any of these issues we talked about today are really a problem for you? Well, the best way to do that is a risk assessment. So I would encourage you to do a risk assessment, at least of these topics that we talked about, which are some of the most common things that we see in the healthcare clinics. Of course, there are many, many different things that you could assess, but I think a good foundation would be to start with looking at these concerns that we talked about today. If you are a member of the trust funds, we have a website, our lhatrustfunds.com website, and we actually have a toolkit for physician office practices, and within that toolkit is a pretty comprehensive risk assessment of the healthcare clinic, and it encompasses all of these things we talked about today, as well as many, many other things. So you can download and you can use that if you want to go beyond these specific patient safety concerns. But what I did was put together a risk assessment specifically for the healthcare clinics that addresses the safety concerns that we talked about today. And if you go to this website on this slide, if you put this in your browser, and you can go in and actually download that today. And this risk assessment I designed specifically for you guys so you can go and evaluate your clinic against best practices and these safety concerns that we discussed today. Now, once you do your risk assessment, you go through it with your team, item by item, and score it honestly to see what your practice is with each of those items in the risk assessment. Once you identify those areas of improvement, those opportunities for improvement, you need to develop an action plan. So as a team, get together and go through those items, score them, find your opportunities for improvement, and then together create an action plan of how you're going to close those gaps. How are you going to change your practice to match the best practices so that you decrease your risks for the patients. Go ahead and assign timelines. I would do timelines, and I would assign responsibility for who's responsible for implementing the intervention, and then come back together within 30 days and let's talk about it and see where we're at. So it's kind of like a performance improvement project is really what it will be. Once everything is in place, I would encourage you to track and trend your compliance. So once you put into place a new intervention, you need to let the staff utilize that intervention for a while, then come back in and kind of spot check the process and whether or not it's been done correctly. You just want to make sure that it is working to your advantage, that your intervention is doing what it was intended to, which is to improve patient safety. So it's a good idea to track and trend that and communicate the results to your staff. So that was kind of the short and sweet version of things to focus on in your healthcare clinic. And I hope that this was helpful to you guys. And I really do encourage you to go to the website that I gave on the slide and download the risk assessment for use in your healthcare clinic. Maybe you could start it on Monday. Anyway, thank God it's Friday, and I hope you guys have a good weekend. I'm going to turn it back over to Tiffany.
Thank you so much, Stacy, for the presentation and taking that next step in developing a risk assessment for us. That is amazing. We really appreciate that. There's not any other questions in the portal except asking about the slides. And so we will definitely be emailing to those who have registered for this webinar a copy of Stacy's presentation in addition to the recording, because we have recorded this webinar. And so I'll give everybody additional minute. If you have a burning question right now, please put it into the question feature or chat feature. And if not, you can please email me or Stacy. She has her email address here if you have additional questions that you need us to answer for you. So I'll give everyone a minute for questions. Stacy, there is a question about the website. Could you go back to that slide to show the website address?
Sure. There you go.
Perfect. All right, I don't see any other questions coming in. So thank you again so much, Stacy, and thanks to our participants for calling in. You'll be getting an email, I would say definitely by the end of the day, in the next few hours, so we can get this recording squared away, so we'll have it in an email to you also. So look forward to receiving that from me by the end of the day, and that'll be it. We'll end the call. Everyone have a great weekend. Bye.
Bye. Thank you.